Hello, Dr. Chi and class. This is Jessica Mendez. Thank you for taking the time to listen to my presentation. I conducted a literature review on social isolation in older adults pre and peri-pandemic, concentrating on the COVID-19 pandemic for our graduate course seminar on aging. To introduce a little bit about this topic, the COVID-19 pandemic posed many new challenges for the elderly population, as they are the most vulnerable. Social isolation in older adults has been a topic of interest in gerontological research for years, but due to the recent times of the pandemic, it has become a more popular topic that requires attention. In this literature review, I will discuss the impacts of social isolation on older adults, pre and peri-pandemic, concentrating on the disparities, limitations, and findings from the research literature. To start off this review, I would like to define social isolation based on the literature. It is the social engagements and physical separation from other people. When conducting this research, there was a lot of information on the correlation between social isolation and loneliness, but oftentimes people categorize them together, which in fact, loneliness in contrast is defined as the subjective feeling of being alone. Social isolation is common in older adults because they endure changes and challenges that push them towards isolation. They have to adjust to their new norms and deal with societal views and discrimination of aging. This creates a barrier in physical and mental well-being. This research topic is important because the aging population is increasing exponentially along with life expectancy. This has led to concerns about social isolation, highlighting the physical and mental health problems that can affect the quality of life in older adults. As mentioned, there is an importance because of the growing aging population and the many effects of social isolation. It can be examined utilizing multiple indicators such as social connectedness, social participation, social support, and loneliness to measure social disconnectedness and perceived isolation. As one ages, their social networks become smaller, which leads to decreased social support and increased feeling of loneliness. Due to this expectation of diminishing social networks, as older adults age and their peers begin to decline both physically and mentally, it's led to the separation of correlation between loneliness and social isolation. The reasons why social isolation is constantly increasing is because older adults are dealing with challenges such as bereavement, health issues, or disabilities, and potential financial hardships. In fact, bereavement is a common indicator that an older adult may be now living alone, which can increase the rate of isolation and/or loneliness. This is only the beginning of the contributing social factors to isolation. Research shows that there are many personal factors contributing to social isolation. The first is weather and location. The geographic location one lives in and inclement weather plays a major role in limited mobility challenges. As an example, if someone lives in an area where snowing is common, they are more likely to be afraid to venture out as they are more prone to injuries or simply be afraid of driving due to health or weather restrictions. If someone lives in an unsafe neighborhood, they are more likely to be physically inactive and socially isolated. If they live in an unsafe neighborhood, it also limits utilizing public transportation and going for walks for older adults. Living in such rural areas is also an indicator of the possibility of enduring financial hardships, leading to not seeking avenues for such physical activities. Mental health conditions can also contribute. Many older adults suffer from depression, and oftentimes, to not feel like a burden to their friends or family, they prefer to self-manage through solitude. Mental health conditions also limit interactions with others, depending on the illness, which also leads to solitude. On the other hand, we have those older adults who prefer social isolation. Research shows that those who have a personal preference of solitude could have lived a very taxing, fast life due to their careers in the past, which led to comfort in being alone. These older adults usually prefer a small circle and have self-imposed restrictions and solidarity activities. They are also practicing continuity theory as they are preserving and maintaining the same existing social patterns they prefer. Health decline and surgeries can also contribute. Older adults have health declines with age, sometimes leading to extensive surgeries, such as hip surgeries as an example. These type of conditions can limit their physical activities and independence. The lack of physical activity, no matter what the contributing factor is, can increase the risk or lead individuals to suffer morbidity, mortality, dementia, infections, depression, cardiovascular health decline, and overall cognitive decline. I will now be touching base on social isolation during the pandemic. The pandemic posed many new challenges for the elderly population. It caused a demand and reduction of physical and social contact. Research shows a fear of new policies during the COVID-19 pandemic, such as social distancing and sheltering in place, increases the probability of social isolation among older adults. The duration of the pandemic can lead to health, economic, and societal impacts on the elderly population. Older adults experience different aging experiences during the pandemic as they do live in different environments. I would like to compare older adults who are living at home versus in institutions during the pandemic. Some older adults live alone or at times with families, but older adults who do live alone are more likely to be isolated and not reach out for help or resources. If they do not have family caring for them, they tend to also get injured more frequently. Literature reviews stated that when an older adult lives alone, there is an increased risk for unplanned hospitalizations, and when in an institution, they have other complicating factors like risk for infection and weakened immune systems. Those who do live in institutions have had more intense isolation due to the many restrictions placed in institutions, such as frequent lockdowns, frequent testing, sanitizing, limiting or restricting overall family visitations, which definitely poses a threat to their physical and mental health. Studies conducted during the pandemic show that the resulting factor regarding social isolation and older adults' health relied on the public health measures and restrictions, duration, and the overall severity of the pandemic. The aging experience is different for all older adults due to cultural issues and ethnic group disparities. In the United States, there is an increasing number of immigrants and ethnic groups. Many ethnic groups hold stigma, which creates an even more critical issue for social isolation among elders. For example, Arab Americans endured critical judgment and stigmatization after 9/11 aftermath, which created barriers to social integration. Also, older adults who might have migrated from different areas of the world may find themselves more vulnerable to social isolation due to the lack of close relationships, social networks, and family being long distance. Lastly, I would like to wrap up this presentation with some reflection and limitations on the research. This pandemic has shed light and importance on the need to address social isolation and mitigate risks by intervening early. Public health intervention should start paying attention to older people's social environment. The interventions set forth should promote social and physical functioning. Healthcare systems need to address psychological needs and interventions tailored to the needs of the older population as well as making them easily accessible. New findings provided during the pandemic showed the response from the older population was definitely driven by the fear of contracting COVID-19. After reviewing multiple sources, they all emphasized the need for longitudinal studies on social isolation as it was hard to set a proper baseline of social isolation months before the pandemic in many of the studies. Now that we have experienced the challenges and impacts of the pandemic, we need to examine the long-term effects of social isolation among our older population, as well as take a deep dive into cultural issues and ethnic stigmas to provide a comprehensive understanding on the influence they have on social isolation in older adults. This literature review has further emphasized the importance of avoiding social isolation in older adults, as it could cause something as severe as mortality. We need to conduct very specific research on the different contributing factors to social isolation. The following slides are references. I really appreciate you all listening. Thank you.